why leaving it on is going to help my patient, because we're trained a lot of times to keep working towards the goal of the patient through our personal training. So we need a reason is, I guess, the best thing I can think of.
Yes, ma'am.
They're not the typical outfitted patient. They have shoulder pads, and if you remove the helmet, you're going to compromise their spine.
Absolutely. Yeah.
Their vitals are stable and you can see them through the helmet, and then you got the baseline. It's not like that when the symptoms are in the neck and you're worried about harm that could come.
Absolutely. Absolutely.
And if you need to remove the helmet, or like the helmet and shoulder pads should come after this movement. Like if you needed access to the chest, you'd be electrically inclined to move it, so they both come off together, they both stand.
Absolutely. So a logical way of putting that would be exactly what you guys said. Because, hey, so this is going to cause unnecessary movement if we remove this. It all has to come off if one of it comes off. And we can leave it here and let it go get x-rays, and then they can remove it at the hospital and have many hands to do it. And it's not down on the ground in the mud while it's pouring down rain. We can do it in a nice, clean hospital setting. Everybody on the team, so does anybody show up as an athletic trainer and think, I want to do some harm today? I'm feeling like, you know, I got to get some of that aggression out. Chris Stock bored me last night. I just got to get some of that out. Nobody shows up that way. And it's the same for paramedics. Nobody shows up saying, you know what, I want to cause some harm today. So when they're talking about a helmet dilemma, where they're saying, hey, let's take that helmet off, they're thinking, they're coming from the standpoint of, I might need to get access to that. And I think this is the best thing for my patient. So when they're coming from it as thinking that this is the best thing for the patient, and you're coming at it thinking this is the best thing for the patient, and keeping that helmet on, you both think that it's best, but you're thinking about it in two different ways. So take the time to convince them that your way is better, rather than just saying, like the 3-year-old, no, my way is better. Leave it on. You're right, but explain that to them. Say, hey, so this is why. This is why we keep that on.
Chris?
Yes, ma'am.
A few years ago, when this was all being debated, the Athletic Training Association met with the Emergency Medical Association, and it was my understanding that they all came to a conclusion, and it was part of the emergency medical response protocol that football helmets were being on if face mask was removed.
It is. It absolutely is, and that's the way we train every new EMT paramedic. The problem is, not all of them are new. And we have those old guys there, or those old gals there that have been doing it for 30 years, when they used to walk right up and pull that helmet right off, and use old wooden backboards that soaked up the blood. That's how you know it was good. Not everybody's caught up with what the top level has said. So we're starting to see that shift towards where we have newer guys that have been trained to leave the helmet on, or trained how to take both sets off with you in that process. But not everybody's going to be on that same page. Like Greg's story, I'm betting those guys were older paramedics, were they?
Well, this was also about 15 years ago.
There you go, 15 years ago, which would make them older paramedics now. Yeah. So when we discuss this, and if you decide that, yeah, we have to take the helmet and the pads off, you guys are going to be the experts in that. I guarantee you're going to be the experts at taking that helmet and the pads off in an appropriate way. So when that time comes, say, hey, I have a lot of training in removal of these. Let me help with this. So if the decision is made to take them off, that it needs to be taken off, be a part of that team, because I guarantee you, I haven't had nearly the training that you have taking pads off. My guess for taking pads off would be cutting the straps and ripping that bad boy off there, which I'm guessing is not correct. Yeah? No? No? Good blank there? All right. Okay. So with that, let's walk through a case. So you're a new lead athletic trainer out of a rural school, and this is your first football game at your new job. State regulations require that the ambulance has to be there for every varsity football game. This is you. You may not be a trainee, so that's you. So what are you going to do before the game to help set your team up for success? An introduction. Great. How are you going to do that? It just walk straight up there and introduce yourself. Absolutely. Yes, sir.
Well, I know that a lot of times, if you're in a rural area, you probably, hopefully, have a pretty good relationship with them already, because you probably see them a lot more.
Great.
So you can have like your relationship from prior help you farther on with this.
Absolutely. Absolutely. Just continue that relationship that's there. Great. So the game starts smoothly. Your team's down 14 to 10 at the end of the fourth. We're into the third quarter. Going into the fourth, offense pushes hard, gets into the red zone, and then things happens. I don't know if anybody's seen this clip. Anybody know what position that is? Servant. Good job. If you're looking on YouTube, you'll find more if you call them that position. All right, so we notice that his helmet pops off, but he still has his pads on. Now what? What's our plan?
Why is that?
I got a lot of things going on. My hearing's not that great. Everybody out of the way that doesn't need to be there. Great. Clear the scene. Make sure it's safe for you. Monitor until the seizure's over. Okay. Yeah.
Once it's done, stabilize the head and check vitals.
Good. What do we want to do before those two steps?
You can
Get
tell
some
them.
help. I can't do this by myself. This is way over my head, and this is over a paramedic's head. And we're not going to sit there and go, well, we'll just wait it out. So, all right. So we have wait till the seizure's over and monitor them, monitor their vital signs, and stabilize the neck. Anything else you'd like to do? Check their pulses. Good. Yeah. Continue to reassess them. Now, we've learned the ABCs, correct, or the CAVs now that they're switching to. You got to monitor. This guy is going to end up having quite a bit of airway problems, potentially. Potentially. So what's a good position to put this guy in if he's going to vomit? How is he going to put him on the side? Which side? Does it matter? No. Away from you. Great. On your partner's side. There's an old joke in EMS that says, how do you know the new guy from the seasoned guy? And the answer is the new guy either rolls the patient towards themselves or rolls the patient towards all the equipment in the ambulance you have to clean. The veteran rolls it towards all the disposable equipment. So great. So we've called EMS over, and we've started to work him up, make sure his airway is clear. If we have suction, using those OPAs, NPAs, BVMs if you need to. What else? Anything else we want to do for him? Spine board, absolutely. This guy needs a spine board. One big thing that we just talked about, yeah. His helmet came off, but his pads didn't. Why is that a problem? Yeah, his head seems to be flopped back. Where this guy, he's got a likely injury up here in his C-spine. So how do we take those pads off? You teach me something here real quick. Maybe one of the seniors that hasn't taught real quick.
You can cut through the middle of the jersey if you're going to use this.
Okay. All right. Just cut straight through it. Good. Good. So getting that off before we spine board him is absolutely essential. Any questions before we move on to our summary? All right. So in summary, most problems that we encounter, whether that be between a paramedic and a nurse, whether it's between a paramedic and another paramedic, whether it be a paramedic and an athletic trainer, or between athletic trainers, can be avoided with pre-planning and understanding our team members. So practicing that disaster, when it happens, what are we going to do? Constantly rehearsing, constantly preparing. One of the great things that, and I'm going to say this with a grain of salt, one of the great things that happened from 9/11 was that it caused every paramedic and every EMT to practice mass casualties. And one of the benefits, if there really are any, from a disaster like that, or Sandy Hook, or any of these school shootings that happen, or mass shootings, is that it causes us to practice these events. Now that's going to need to carry over into the athletic training role as well. It's just as likely that that happens at a football game, because you're going to be the first responders on that call. It's just as likely to happen while you're in practice or at school. So make sure that you practice with those paramedics and those firefighters. They do a drill every year. I would almost guarantee that about 90% of the fire departments in the United States practice a mass casualty drill once a year. See if you can get in on it. See if you can get in on it. Call them up and say, hey, I want to be a part of this. How can I help? And that will help you to be more prepared when it does happen, because it will eventually happen. So not all conflict is bad. Point number 2. Not all conflict is bad, and using each and every opportunity that you have, each and every interaction. This gentleman in the back said, you may have a relationship built with the EMS people before the call, before this happens. Continually building that relationship by doing things like talking with them when there's not a disaster about how you can help or how to integrate your teams. Making sure that after the call you debrief with your department and saying, hey, not just within our team, but within the greater team, the bigger circle of folks. How can we improve upon this? How can I improve? And then the last thing, practice, practice, practice. You've heard that saying over and over again in sports, but I would bet that everybody in here was involved in athletics before they became part of athletic training. And that's our real big piece, is practicing. Just like you would practice drills on a sports team, practice this on our team. So with that wraps up my presentation for you. I want to field any questions you have. We want to just kind of open this last 15 minutes up to what you guys think, what questions you have, and anything moving forward from here. Yeah, go ahead.
Does the same paramedic team usually work the same like area, like in terms of like a football? Like is the same team like every Linfield game, or does it kind of change?
So that depends on where you're at. So here in Linfield, I don't know. I'm guessing. Well, actually, I do know that. So if it's here in Linfield, it's going to be Linfield Fire. They're the transporting unit for this area. Now, if you go into Multnomah County, it's going to be AMR. At the professional sporting events in Portland, it's going to be Metro West. They have that contract. Depending on where you're working, so that's a great point. Is where you work, find out who comes when I call 911. Who comes? Who's that agency? So maybe it's public, like a fire department or a third service, or maybe it's a private agency like AMR. And it may not be the same crew. Yeah, Tori.
So you mentioned like the contracting out. So AMR versus what?
Metro West, yep.
Do they all follow the same protocols?
They don't. So that's another key piece, is in different geographical areas. So it's generally done by counties. Different medical directors allow their paramedics to do different things. So as a paramedic, you can do anything a doctor lets you do. But what the doctor lets you do varies from spot to spot. And so getting familiar with kind of what they can do. And a lot of places will give you their protocol books. Some of them, like Multnomah County and the Tri-County area, you can find their protocols online. But most of them aren't that progressive quite yet. So you can ask them and they'll give you a copy of their protocols. Yes?
I mean, we kind of touched on it briefly, but what would you like recommend for if we were ever in a situation like Greg, where we got into a case where the paramedics were going to do something that we knew was going to be bad for the athlete, and we tried to explain it to them on why not to do it, but they were like wholehearted into doing that. How would you suggest like what steps we should take?
So that's a very difficult one, because now we're talking about something that's somebody that's denying logic. That's saying, I'm going this direction, I don't care what anything else around me says. So my best answer to you is use this scenario to your best advantage. If they're going down the route of taking a helmet off when they shouldn't take a helmet off, be a part of that. Make sure that you help them do that, because they don't have the training for it. I know that we don't teach it in our paramedic program. Maybe we will now, but we don't teach it. Most paramedic programs don't teach it. So if it's something that you know how to do and it's going down a slightly different path, that's okay, that you have expertise in, you can help them do that so it's less impactful. If it's something that is so bad that you can't let it go, then there's a few different ways to do that. Like Greg was saying, the orthopedic on scene stepped in and said, no, this is my patient, and he outranks a paramedic. Any doctor If plantar fasciitis breaks out, then we'll call you. They still outrank all of us in that field. So getting a doc on your side and using that. The other option is riding in with them. And then they're going to outrank it. So in every county, the transporting paramedic is, for most counties, the transporting paramedic is the final say in all treatments. So whether a fire paramedic says one direction, this happens quite frequently. The fire paramedic says, I'd like to do this, and the transporting paramedic says, I'd like to do this. It's the transporting paramedic that overrules it, because he's ultimately the one responsible for care all the way to the hospital. So if you can't make your logical argument, and you can't have a doc ride in with them or make that decision for them, then unfortunately sometimes you have to eat it and then improve upon it on the next time. You go big picture. And I know that's not a good feeling. I know everybody just got kind of this feeling in their stomach, and it does that to me too. But for lack of a specific scenario, and for lack of an exact way to do things, that's the best answer. And do your best to make sure that your patient, your player, gets the care they need.
We've always had a really great situation here because we know who's coming. It's not gonna be, when we call that somebody we don't know is gonna show up. So it's really to your advantage. And so what we would do is we had a regular thing where we get the head of the emergency, of the paramedics and our team physicians and the athletic training crew together and go over things before a preseason even started. So
That's part of that educating.
being proactive is always the best way to take care of conflict, so that you avoid it from the very beginning.
Absolutely. And that way you have a relationship built, so when
Yeah, and
conflict
the
does
other
arise.
advantage is that most of the people who are gonna respond here are Linfield grads.
That's nice.
We've got a lot of Linfield grads on the fire department.
That's fantastic.
So you already have a relationship with them.
Yes, ma'am.
How critical would you say it is, and maybe it's paramedic unit by paramedic unit, but how important is it that the emergency equipment that we have and we use here be the same brand that the paramedic crew is? Is there like a standing that if they come and we put a certain type of splint on and they've got a different brand, the paramedics want their splint versus our splint, their backboard versus our backboard, their C-collar versus ours?
Shouldn't matter.
Okay.
Shouldn't matter, and I say shouldn't. I can't say absolutes because every paramedic is a little bit different. But as long as your C-collar works, as long as your splint works, we should be able to roll with the punch and say, hey, great, that's awesome, it's on there. Thank you for that. The only thing that is nice to have being the same is your AEDs, your automated external defibrillators. If those pads have the same connector as our monitors, so I don't have to rip off pads to put our pads on. You can just unplug your AED and plug it into my monitor. That's where it's a nice thing to have the same equipment and be all on the same page. But other than that, as long as your equipment works, it could be a different style, it could be a different brand. That's fine. Yes, sir.
Do vacuum splints have different like nozzles and stuff like you say? I haven't seen that much of a variety, but like could there be a situation where you could get the beaver pump and take the vacuum split off?
Should always be able to get the vacuum spun off, because if you suck it out, we can always poke a hole in it. So vacuum splits, just as a general knowledge thing, paramedics and the ambulances generally don't carry vacuum splits. They're really expensive, and for how often we use them, for how much space they take up, it's not worth it for us. We buy the cheap 15-cent pieces of cardboard and a roll of tape and figure it out from there. Great. Well, thank you for being an excellent audience. I didn't sweat up here too much. I didn't kick that trash can over there too much. Not about. So if you have any other questions, Tori knows how to get a hold of me, and I'm going to be around here circulating if you just want to chat for a bit. If not, I'm going to give it back to your faculty members, and yeah.
Thank you.
Thank you.